during adolescence, we have a syndrome which is called identity crisis, which is not the same as identity diffusion. Identity crisis refers to a discrepancy between a view of the patient of himself and the social experience of the patient because of their traditional view of viewing that person. Typical for adolescents. Adolescents change, have significant changes in their experience, in their behavior, but tend to be treated as if they were the same children as always. So there's a discrepancy between self-concept and concept of significant others, and the concept that others develop or maintain of the adolescent who has changed. So this discrepancy between one's own experience and how one is treated affects adolescents in addition to whatever difficulties they have, and may express itself into a sense of confusion about self because they are changing and don't know exactly what they want to do, confusion about the reaction of others that doesn't correspond to how they feel. And during adolescence, there is a rapid, intensification of affect expression, and the affect expression corresponds to growth in the limbic system that is earlier than the corresponding growth in the cortical system. So the cortical cognitive control of affects develops during late adolescence, where in early adolescence there's a proneness for affect storms, contradictory behavior that may give one a sense as if there were a problem of identity diffusion, and feelings of insecurity, changes in which self and others are evaluated. But with all these changes, there is really a stable system of values that is maintained. So the adolescents, with all these affect activation and uncertainty, know what they basically believe in and where they stand. Their interests and commitments are stable in spite of crisis in their behavior. And when we try to assess their evaluation of other people, it's very realistic and in depth. So adolescents may be in a crisis, but they have a very precise and sharp way to evaluate so their parents and their family. So the stability of the value system, the capacity of evaluate others in depth, the persistence of creative activity in many fields, showing the excess of energy, not simply confusion, and the capacity for emotional relation in depth signals identity crisis as different from identity diffusion, because in identity diffusion, even in adolescence, and that permits a differentiation, there is a chaotic conception of self and others that comes through in their evaluation of self and others.